Hello, I am Nicholas Akimoto, and this is my presentation for my PACE 310 project, and I will share screen now. So the title of my project was the efficacy of the COVID-19 vaccine. And just a brief introduction, the group that I chose to volunteer for and work for was the American Medical Center. They are a private healthcare provider on the island of Guam, which is a Pacific island within Micronesia. And while I was there, I was placed as a project coordinator in which we combated COVID or we strove to combat COVID and provide accessible healthcare. Uh, Now, a lot of our actions were very much guided towards addressing COVID. So we would go out into the communities and interact with different social groups in order to provide different people with the vaccine and testing uh, when they needed it. Our overall mission was just to make COVID vaccines as accessible and efficient to get as possible so that more people were encouraged to get it, uh, and making that entire vaccination process as convenient as possible. And that included retrieving their vaccine records, which is critical in this point in time. Now, just for my analysis of how COVID, my analysis of the micro, meso, and macro level is sort of different than how I may have presented it in the past. And I decided that the best way to analyze it was just generally how COVID affected the world, and you'll see why later. On a micro level, individuals were either forced into isolation to prevent infection or had to endure the harsh effects of the virus. Um, I believe that many of those who are watching this presentation may be able to, have a firsthand testimony of how COVID effectively changed your life, and on a meso. So that goes into my point of on the meso level analysis. Due to being forced into isolation, communities lost business, education was forced to change drastically, and general human interaction was severely limited. Um, this can cause major negative effects on peace in general. Um, the economy is a huge factor, as shown in the Global Peace Index, in overall peace, and not being able to interact with other people, with your community. I can personally attest to being a major negative effect of COVID-19. On a macro level, world governments shifted focus from international relations to mitigating COVID within or it says government here, but within their borders, is what I meant to say. International trade and other industries were harshly affected by the closed borders as well. And this is just, attesting to how international relations has changed due to COVID. And this is not purely within the COVID era, as we may call it in the future, but the effects of COVID may be felt uh, for years to come. And, COVID, it can be seen as a sort of turning point uh, in the terms of international relations. Now, I just want to speak a little bit more in depth on the effects of COVID-19 on peace. As I spoke, the loss of sense of community is, a huge negative effect on peace. Not allowing people to build communities and society to build can lead to is a major point in negative peace. Cultural and domestic violence rates climbed during this time. In my video, you'll see a clip in which they address this, and and the reason why this cultural and domestic violence rate may have climbed, if I just introduce the idea, cultural violence climbed specifically towards Asian Americans at this time due to the origins of COVID-19, and domestic violence rates climbed due to the quarantine that was required in order to mitigate COVID. Uh, Partners and children were forced to live with their abusers, and due to the nature of the virus, they were not allowed to look elsewhere for shelter. So domestic violence rates climbed at this time. And also due to the pandemic environment, exacerbate glaring holes in our government systems, in our nation systems, were exacerbated, and that exposed cause for structural violence. One such case, which is very prevalent, I think, in most people's minds, is the George Floyd incident that happened in Minnesota. Uh, while it may not be a direct effect of COVID-19, I think we can agree that COVID-19 may have, or definitely played a role and was a factor in, the environment and atmosphere of the time. COVID-19 also caused major negative economic impacts. Like I said before, international trade and other industries were majorly affected by COVID-19. And medical resources were overextended and in mass demand at this time. The obvious masks and even for some reason toilet paper was in mass demand at this time and overextended. But having worked with a medical provider, it's easy to see how these medical resources were in demand, and it was difficult to acquire them at times. But another one that I think is less spoken of are mental health resources, which there are numerous reports of mental health hotlines during the beginning of the pandemic. They were in mass demand and they were unable to meet the demand of the people calling in, which I think is a major unfortunate circumstance of the virus. Now, this is my video and I'll refrain from playing it at the time, but the link is attached to my submission of this project. Now, in my video, I will mention how it will be more so an analysis of the vaccine and how it addressed those initial impacts of COVID-19. By no means am I trying to say that the vaccine is the end point of COVID-19. The vaccine is merely one tool by which we combat the virus. And I think it's important to recognize that we are not out of coronavirus, and I doubt we will ever be. However, the vaccine is one tool by which we can combat the virus and, grant our public health systems some time to, recoup and adjust their defense against the virus so that while coronavirus may never go away, it can certainly be way easier to deal with in the future. The vaccine allows for our public health systems to be alleviated of some of the stress caused by an unvaccinated, undefended population. And when they go into the hospital, they require less resources as they are, if they have the vaccine, and their likelihood of death is severely lowered. The vaccine also authorized many of the state governments to lift the restrictions that they implemented in order to mitigate the virus. And this allowed for the growth of communities again, and which also caused the economy to be able to be re-stimulated. And while we are still, at this point, 1 year out of the distribution of the virus almost, or vaccine almost, I think we can already see those effects, those positive effects. We're already feeling them now. So I think that is a direct product of the virus or the vaccine. However, I think it's important to know that coronavirus is not going away, and we may have to do another re-roll of the vaccine due to the nature of the virus and the booster shots that are necessary in order to continue to bolster our defense against the virus. Now, just some concluding thoughts. While COVID-19 is a complex disease that will continue to develop, our defense against it is adapting positively through the vaccine and through developing treatments. These different tools are granting us an opportunity to look to the future and enact positive peace. Recent GPI reports are reporting that peace is the average GPI global peace index that fell 0.34% last year is a little bit more on the rise, but especially looking towards the economic impact within that report, you can see that the economy is definitely on the rise, and that is in due major part to the vaccine. So this is just my presentation for the project. I go a little bit more into detail in this presentation than I do in my video. I also go into more detail in my video than I do in this presentation. But thank you for watching this, and I apologize for the technical difficulties that you may encounter during my video. But thank you.